Hi, I'm Jason Schroeder, founder and chief executive of the Scottish Men's Shed Association, which is a registered Scottish charity. Men's sheds are one of the most important interventions to have positively impacted men's health in the past 30 years. And it all started, in all places, Australia. Australia has great weather, so why would men feel compelled to be indoors? Unlike in Scotland, which often only has a week, if we are lucky, called summer, makes much more sense to me. But without diving into the health needs of different genders, it just didn't make sense. To me, anyway. Australia now has over 1,000 men's sheds and still receives over $3 million of government funding every year. 30 years on, and they have reached shed saturation. So why still the investment? Well, let's dig a little deeper into this new modern male health phenomenon for the 21st century. What started out as a project for me personally in a very affluent community in West or Aberdeenshire in 2009 took 4 years to get the doors open, and in that first year hosted over 3,000 visits. It was this success and need model that I knew would be a groundbreaking new cultural and health initiative for the people of Scotland, if we could get it off the ground on a multi-scaled level. Unfortunately, this wasn't to be in the first case. I co-founded the UK Men's Sheds Association and represented Scotland with any of the inquiries, etc., that came our way out of that association. Unfortunately, the funding stopped at Newcastle and stayed in England. And so even though the name and the vision incorporated the UK, sadly, this just didn't happen and still doesn't happen, even though they still have the name UK MSA. So I started the Scottish Men's Shed Association in 2014, and we became a registered Scottish charity in that year. In October this year, we celebrated our first decade in Scotland with over 4,000 members, which I'm very proud to say makes us the biggest men's member-led health charity in Scotland. We now have over 200 shed groups with 15 in the Greater Glasgow and Clyde area. I alluded to earlier that there are different needs between the genders, and to get most men to volunteer for something that isn't risky, dangerous or challenging, still with a dopamine rush due to our male hardwiring, and I am generalizing here about males and females, well, it hasn't worked on a mass engagement scale since, sadly, the Second World War deployment. Until now, but in a very, very different way, with a very, very, I'm glad to say, different outcome. If one can create a place and a space where men feel accepted, safe, and with a purpose, with the men in control of their ship, then it appears that men will voluntarily gather. Who knew? The men's sheds I'm speaking of today are on a grand scale compared to your garden shed. They usually have workshops in them, but the main aim is for a place for men to come and socialize in a healthy way, without alcohol, drugs, or aggressive competitiveness, which is often what we see in the workplace. And when we are no longer working, that socialization space is lost to men. And often then in retirement or being unemployed, etc., this engagement model of socialization for men has just disappeared overnight. And we really, really struggle. So there are places where men can voluntarily come, feel safe, make new friendships, maybe learn or share skills with other men, and talk about things that matter to them, put the world to rights. They open up and talk because the environment created of using up their testosterone with a purpose, and the purpose is really important here, which could be anything from computer 3D modeling, workshops, activities, gardening, cooking, playing cards, pool, and then resting over a cup of tea in the social area. And then when we get a bit antsy again, let's get up and go back to our activity. And so we have the stop-start, this like yo-yo effect, if those of you remember yo-yos, up and down, and that works incredibly well for the masculine body type. We call this masculine communication in the trade of men's sheds, which was coined from Professor Barry Golding in Australia, shoulder-to-shoulder communication. When we're shoulder-to-shoulder, we're looking at something in front of us and we start communicating. Differently with women, who straight out the gate can be face-to-face, look at each other in the eyes, don't feel threatened, and start talking. So women face-to-face, men shoulder-to-shoulder. As our testosterone levels drop and we socialize in the social area over a cup of tea, body language goes from shoulder-to-shoulder to face-to-face, and that's when men make this connection and the friendships form. And it's a shoulder-to-shoulder, face-to-face, shoulder-to-shoulder, face-to-face, as the testosterone level changes within the masculine man. It is in understanding the impacts of testosterone and estrogen that we have to come to understand what these impacts are and how to cater specifically and successfully in creating this new health by stealth movement in Scotland, which presently and voluntarily, very important that, voluntarily is engaging over 10,000 men. Can you believe it? 10 years ago? Nope. 10 years on, over 10,000 men. Amazing. Now, these new social places of masculine engagement are vital to helping men move on from the strong and silent stereotype, and which our culture has been plagued with, and I do use word plagued, which creates all sorts of problems with mental and physical health that we're seeing all over the world. We have a problem in this country and globally actually, where we're uncomfortable with the concept of seeing men as a group of people, a protected characteristic, if you will, who actually need support. And why wouldn't we? Well, we have a women's and an LGBTQIA plus groups, but labelled, but nothing for men. We have a women's champion now in the Scottish Government. Fantastic. Thumbs up for that. Absolutely. And a minister with a woman in her portfolio of equalities. Not a mention of men in anything around that. Not good enough. Unfortunately, we don't have the time today to look at the history of the past 105 years, with special reference to the Scottish Women's Institute, which I took their constitution, changed the genders, and there we have ours for our SMSA, Scottish Men's Shed Association, like for like. We are living in a very different world of 105 years ago in Scotland when it formed, and knowing one's history allows us to not keep making the same mistakes over and over again. The reality is, men have and are suffering silently. As we've been told, as mentioned before, the ideal man is strong and silent. So you haven't heard about our internal challenges because we believe and have been told that it shows weakness to share them. We internalize our issues in a single focus way, and sharing them verbally is not a hardwired solution, unlike in our female genders. Men have very specific emotional needs, believe it or not, ways of thinking and ways of working. And if these needs are not firstly understood and then addressed, it leads to the problems we are experiencing today. Scotland has, unfortunately, the highest rate of suicide deaths of all countries. Let me say that again. Scotland has the highest rate of suicide deaths of all countries in the UK and last year in Europe. Suicide in males is over 3 times as high as the rate for females, and it affects a specific age of men. And it's a young age group, over the age of 22 to 45, I think it is. That means, to me anyway, is the worst and most challenging place for men and their partners and families who have a male relationships to live in. This pattern has been going on across Scotland for years and continues to get worse. The old efforts and support systems are clearly not enough and not working well enough. The numbers are going up, not going down. as our environment and our world is changing. The men's shed model, in my opinion, is the first successful, life-changing, preventative, let me say that again, preventative engagement model for the 21st century man over the age of 18, which is now in 16 countries and all within only the last 30 years. That is amazing. So young fathers, sons, brothers, husbands, grandfathers, partners who feel internally that they have nowhere to go and can't talk. And it's not that they've got nowhere to go, it's just that they don't go. They don't talk about how they feel without feeling shame and process things because it's seen as weak in our culture. And they've had the perceived reality. It's all their way for long enough as men. And we've grown up like our fathers and our grandfathers with statements like, oh, man up, grow a pair, boys don't cry. So this essentially is programming us as young boys. That means emotionally connected and intelligent is seen as a negative way of being. So we close it down from a very, very, very young age. And different cultures show up in different ways. What we find is if we have cultures with less sunlight, it closes down quicker and we take to alcohol and heavier alcohol to cope. Our patron, I'm very proud to say, is Sir Harry Burns, who you will have known as Scotland's Chief Medical Officer and is knighted for his service to the people. And he said in one of his talks to us that it is alcohol that is the problem, the biggest issue in Scotland. It's not the food, it's not anything else like smoking or weight or anything. It's alcohol. So unless we can show a different place than the pub and the bookies for men to go, and as we say in our world, the men's shed is the new social place. It's the new smart social place to go. And I'm hoping in the generations that follow that the men's shed will become as the pub and the bookies is in our culture today. Everybody will know about it, but you will have to wait until you're 18, seen as a man, which is almost a rites of passage, to be able to enter the men's shed. And I think that's a very, very healthy thing to have in our culture, which in my opinion is sadly lacking. The truth is men are desperate in need of support. And men's sheds are a way of providing them with a secure place to still be strong, but also be vulnerable and open. In this environment, we see men speaking to each other in a non-clinical setting. It's important. About their deepest and darkest fears, health issues like prostate cancer, erectile dysfunction, loneliness, the permission to take respite for themselves when looking after their partners, guilt and shame-free. The list goes on and on and on. When I tell you, when you start digging, it's endless what we've bottled up over centuries. It is vitally important to realize that men do not in the main speak about these in front of women, and sadly not to their partners, until often it's too late. This is why men's sheds need to remain the domain for men only, like the Scottish Women's Institute. They've enjoyed for women, fantastic, over the past 105 odd years, and still thankfully do today. We've partnered with Glasgow Caledonia University in a 4-year research project costing £150,000, which generated international peer-reviewed and published papers re Scottish men's shed sustainability and health. We saw that the health system needs to evaluate health outcomes differently. Men's sheds can positively impact at least 7 of the Scottish Government's policy ambitions, but we're stuck with the same level of seed funding we received when we started 10 years ago with 2 sheds of only £70,000 per year 10 years on. Honestly, what can you do with £70,000? Actually, we do a lot with it, but in the grand scheme of things, it's not very much at all. Worse than that, the Scottish Government has tried to remove our funding for the past 3 years in a row. Why, when our internationally and Scottish Government approved social return on investment document, which shows a social return of, for every £1 invested in a men's shed, you get a minimum of £10 return. This makes no financial sense to a cash-strapped NHS and national budget. So why don't they want to invest in men's health through men's sheds, as they are doing in minority groups and other protected characteristics, with nowhere near the return on the fiscal investment? Martin and the team here today have talked about the positive impact of creating a men's shed in reducing social isolation, addressing health inequalities, and improving skills. But if our society is blind to the fact that there is a specific need for this intervention, then how can we make it grow in the way that it needs to grow, as we see in other countries? If we want an equitable society, we need to understand that helping men doesn't mean we're taking support from elsewhere. It's actually positive for everyone. So let's go one level higher than genders. We are all human beings. And let's accept with different needs, which includes men, which is actually 48% of Scotland's population. We started with 8 people in Scotland in 2014, starting up our charity, addressing in a new way the inherited silent cultural male health issue. The Scottish Men's Sheds Association, SMSA, now supports over 200 sheds across all 32 local authorities, helping over 10,000 men, all being volunteers who need a central support body who understands their needs and struggles and helps them not reinvent the wheel from a seed thought right through to opening the doors and then their sustainability. This in turn impacts on all levels of society and their families and local communities. If that's not the proof of need, honestly guys, I don't know what is. I hope you can leave here today with that message in your mind. Please speak about this now decade-old male health by stealth initiative. Help us receive the funding the successful and financially brilliant return on investment requires to keep this fledgling movement growing. Ireland, very similar to Scotland, received €1.2 million last year from their government. And they have double our number of sheds, supporting thousands more people and communities. And they're only 2 years ahead of us in the development curve. We can't do it without you. So join us if you live in Scotland, want to see the men of Scotland healthy and thriving. Please remember that the Scottish Men's Sheds are all independently run by non-professional volunteers who are there firstly for their own beneficial health reasons. As one shedder said to me, we care, but we are not carers. And it's very important that the health sector understand this, and social prescribers and GPs, etc., understand this. They are volunteers there in their own right for their own health, self-prescribed. So they're not there to help or care for others in that sense. It's really important. If you know someone who would benefit from visiting their local men's shed, encourage them to visit our Find a Shed page on our SMSA website. We get over 3,000 visits to that page a month. It's our most busiest page, people wanting to find out where their local sheds are and encourage them to go. And lastly, I'd like to thank you for the service you're providing our citizens and our well-being and health in the country. And I look forward to working together to create a country of well-being for many, many, many years to come. I'd like to thank Martin and the team for highlighting that the men's sheds even exist and that it's been brought to you today in this health domain, which I've been struggling to get involved with for over a decade. So thank you, Martin and the guys, for putting men's sheds up on your agenda today. Groundbreaking work, gentlemen and ladies. Thank you so much. So enjoy the rest of your day, and thanks so much for your time. Take it easy. All the best.